Everyone, I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is our live webinar where we talk about Lyme disease and any questions you have. The way that these work, so that we can get through as many questions as possible, I actually have everyone write their questions to me, and you can do that in the chat box. Because I'm using the chat box for questions, I would ask that you don't communicate back and forth through the chat box if you're doing that to everyone. You could do a direct communication with another member. It's just I don't want it clogging up, making it more difficult for me to find the active questions within that chat box stream. Okay, so that's the main thing I ask. As usual, I am creating a recording of tonight's webinar, and my intention is that I'll have that ready for you tomorrow morning, somewhere between 9:30 a.m. Central Standard Time. Okay. And then as I read the question, I'll give an answer, and then I probably will need to clarify. I may need to clarify things, and so the person that asked that question, I'll interact with you directly. Hopefully, you'll turn on your video so we can actually see you. I like seeing people, and for those of you that left your camera on tonight, I really appreciate that too. I feel like I'm not talking to a wall. I'm actually talking to people. So anyhow, and then after I answer the questions. Then I'll open it up for a discussion about that question. Now, when I do open it up for discussions, it's really to ask follow-up questions or comments about the question we just discussed. So I want to be clear, that doesn't mean it's a free-for-all where you can ask about anything. Try to keep it to the topic at hand that we're talking about, okay? Now, I do try to get through as many questions as possible. I usually don't get through all of them. Keep in mind, this is the main purpose of these webinars is education. And although I know you're also hoping to get some ideas about how to make your situation better, it doesn't necessarily mean we're going to get through everyone and me be able to help everyone directly. Okay. All right. So having said all that, welcome here, everyone. I've been waiting for, give it a little more time for people to gather here, but it looks like we got a good crowd. And we'll go ahead and take the first question here. So the first question, so if you want to read along with me, you can look at the chat box. You're going to see the same thing. I am going to read them so that they show up in the recorded version, or that people hear the question in the recorded version as well, too. Okay. So hello, Dr. Ross. Thank you for all you do. I've been helping my wife, Mindy, with BART and mold for 2 years. She was on diflucan with nystatin for the last 9 months and itraconazole for a month, all with methylene blue and with a few other pharmaceuticals as well. Saw some improvement with some symptoms, but are stuck. Our Lyme practitioner wanted to go the herbal route, yet most recent real-time lab mold tests positive for all 5 groups, ochratoxin, gliotoxin the highest. She has history of candida. After reading your info on yeast and mold, I asked to try amphotericin B, yet was denied. She suggested GI detox. Will itraconazole, Capri Plus, nystatin, and methylene blue help with the mold problem if we go that route? Can you take GI detox along with the above, or do we need individual binders? And what would you suggest she takes if not Ampho B? Thanks, Cal. Okay, so let's talk about, I'm going to start by talking about mold toxicity first, okay? And then we'll kind of layer that into her underlying problems also of yeast and then of the Bartonella too, okay? So let me just go that way first. So when you have mold toxicity, the issue for most people is not that they are colonized with mold living in them and colonized with mold toxin producing factories. Okay, I want to be very clear about that. What most people have is an issue that they've breathed in mold toxins from their environment, and their immune system did not make the right kind of antibodies to attack those toxins. And then with the antibodies and the rest of the immune system, break those toxins down so that these toxins actually get trapped in a person. All right. So what is supposed to happen in 75% of healthy people is you breathe in a mold toxin, immune system sees it, tags it with an antibody. And once those antibodies are stuck on that mold toxin, other white blood cells come in and eat up the germ or the toxin. They just destroy it. Okay. So there's nothing left of it. It can't bother you. It's gone. It's taken care of by the immune system. What happens in 25% of people is there is a genetic programming error where the antibodies do not correctly recognize the mold toxins, so they don't get tagged. The rest of the immune system doesn't come in and break those mold toxins down. And then what happens is those mold toxins Normally, a fat-based toxin like mold would be sent to the liver, and in the liver, it would be transformed into a water-based toxin through a number of steps, including using glutathione. And then that water-soluble toxin would be moved out into the intestines, and you would poop it out. But that doesn't happen. What happens is with these mold toxins, they actually get excreted by the bile system. The liver doesn't even detox them. They get excreted by the small bile ducts within the liver into the big bile duct. Some of it gets stored in the gallbladder, but they get excreted as a fat-based toxin without modification out through the bile system into the intestines. And once in the intestines, they get reabsorbed again. They just get back into the bloodstream. And so you get this endless swimming pool of toxins going around. The reason those toxins are a problem is number one, they are directly damaging and injuring cells in the body, right? But in addition, they trigger the immune system to make tons of cytokines. Now, many of you may be familiar with the idea that when you have tick-borne infections, your immune system already is making too many cytokines. Cytokines are chemicals made by the white blood cells to attack a toxin or attack a germ. They also help turn on the immune system. They cause more white blood cells to be made, and they help the immune system find the target, basically. Okay, but in tick-borne infections and in mold toxicity, because the immune system doesn't do a good job handling these problems, it eventually makes too many cytokines. And the symptoms of too many cytokines, whether they're triggered by mold or whether they're triggered by Lyme or whether they're triggered by Bartonella, are all the same. They're brain fog, they're fatigue, they make you hurt all over. Cytokines make it so your hormonal systems don't work right, et cetera, et cetera. Okay, so the underlying issue is that when you have a mold toxin issue, it can make it look like your Bartonella treatment isn't working, or it can make it look like your Borrelia treatment isn't working because the mold toxins trigger all these cytokines. And if the cytokines don't start lowering, your symptoms aren't going to get better, even though your Bartonella treatment may have knocked down a lot of Bartonella germs already. Okay. All right. So how do you handle this? Well, because the majority of people, the problem is a recirculating swimming pool of mold toxins, you have to get rid of them. And the only place you can get rid of them is when they pass through the intestines, when the biliary system excretes them into the bile system and then they get out into the intestines, we can grab hold of them out in the intestines to pull them out. And to do that, we use binders. Okay, that's where the word binding comes from. Now, I'll talk about binding a little bit more in a minute. Now, a lot of us that treat mold toxicity will basically spend the first 6 months or so working with binders alone. And for 90% of people in my practice in Seattle, Washington, 90% of the time, all I had to do was work with binders. I never had to put somebody on something to kill mold. All right. I want to make that clear. All right. Now, if you get 6 months into treatment and you're not seeing any improvements either in your mold numbers or in how you're feeling, then it may be time to start wondering, when you lived in that moldy environment, did you breathe in some mold spores that started inhabiting microscopically the mucus of your sinuses? And maybe even you swallowed some and started living in the mucus of the intestines. And maybe the reason you're not getting better at 6 months, either with your symptoms or with your testing, is that you're colonized. Okay. Now, we don't have a good colonized test. So most of us don't start treating with mold killers until we see that the binders themselves are not working well enough. All right. It's kind of you back into the diagnosis of colonization. All right. Okay. Now, having said that, I want to caution everyone about one thing. So remember I said you go back and you retest about 6 months out. All right. Now, here's the tricky part about measuring your mold toxins in your urine. When you are really toxic, although the major organ that's supposed to remove fat toxins is the liver and the bile system, the kidneys actually can remove some of those mold toxins too. Not a lot, but a little bit, right? And for them to actually remove those toxins, their detox systems have to work. When you're really full of toxins, sometimes what happens is the ability for the kidneys to pee them out is not that good either. So one of the things that can happen sometimes is as you start using your binders, when you do your repeat test in 6 months, it may look worse. And the reason it could look worse, one of the reasons is that your kidneys, because you've removed some of that mold toxins, are starting to work better at removing the toxins into your urine. Okay. So when we reassess a person at 6 months, there's actually two things we're looking at. Number one, how do you feel? So let's say we did binders for 6 months, and at first you got worse with the binders, but then by 6 months you're doing better, not all the way well, but better, and you have a test that looks worse, what that means is you're getting toxins out, and because of it, your kidneys can dump these toxins better into your bladder, and you're seeing more. Okay, so we have to interpret that follow-up test based on what's happening with you. All right, now let's say we do the follow-up test and it looks worse, and you feel like absolute garbage still, you haven't gotten any better. That's a situation we might start thinking, I wonder if you're colonized. Let's put you on something to kill the fungus colonization up in the nose and possibly in the intestines, okay? And in that situation, what I like to start with usually is itraconazole, because it will get into the intestines, take care of that. It gets into the bloodstream and comes back and hits the colonization up here. I'll try that for a month or two. If itraconazole by itself is not working well enough, then I will also add some kind of a nasal spray, the antifungal. And the ones I might use a colloidal silver. I might use a nystatin. I might use an amphotericin nose spray. I might even use a itraconazole nose spray. All of those have to be made by a compounding pharmacy, except the silver you can get as a spray without having a compounding pharmacy make it. Okay, so I want to let you know mold toxicity is extremely confusing when you're trying to figure out, is treatment working? Because again, it can look worse at first, but if you're feeling better, it means that the detoxing is working. Okay. All right. Then one last thing. If you've got high mold numbers, you have mold toxin numbers, you've got to wonder, where did it come from? Now, it could have come from a life of exposure. It could have come from the work building you worked in that had mold up in the ceiling you didn't know about. It could have come from the home you lived in 5 years ago, but now you live in a new home and it may not be there. Okay. But one thing I always encourage my patients to do when you first get that test that's positive, you're going to have a better chance at recovering if you live in a clean environment where you are now. All right. So I usually encourage my patients to also get a mold inspection done at the home, just to make sure that you're not being poisoned where you live. At the same time, we're trying to unpoison you. Okay. All right. So I hope that answered your questions about why would they go with a binder. I would go with the binder. And GI detox, when you have a smattering of different toxins, the GI detox has a number of things in it. It's got zeolite clay, it's got activated charcoal, it's got humic acid, fulvic acid. I think it's got some silica in it too. It's what I call a broad spectrum binder, and it's actually binding a variety of all those toxins at the same time. That is where I usually start in a situation like this. I usually start at one a day. If a person that doesn't make person worse, I might go to 2 pills one time a day. And as the person adapts to that, I might work up to 2 pills twice a day on that. Okay. All right. So that's what I would do there. In terms of your question about itraconazole, Capri Plus, nystatin, methylene blue help with the mold problem, no, well, itraconazole can, but as I said, I don't think you need to at this point. You need to start with binders. You may not have a colonization. Okay. And then, can you take the GI detox with all those? Yes, no problem at all. Okay. The thing about GI detox, though, and the same thing with any binders, they're better taken away from everything. So, what I advise people to do is to stop all your medicines and your supplements about a half hour before you take your GI detox. And then 2 hours after you take your GI detox, you can resume taking your medicines and supplements. Okay. Secondly, the gallbladder, where some of these are stored, contracts every time you eat. And where the opening of the gallbladder is into the small intestines is about a half hour south of the intestines. Okay. So, one thing you can do is after you take your GI detox, about a half hour later, when it's worked its way down to where the gallbladder spits everything out, it's good to have a small amount to eat, a snack, a few bites. It gets the gallbladder to contract. Okay. All right. All right. So anyhow, that's my spiel on that. I'm gonna so Cal, did I answer your questions for you there? Or do you
Yes,
have
thank you. Thank you
yeah.
very much.
All right. Good luck with that.
Appreciate it.
Yeah, good
Thank
luck.
you.
Good luck. Does anyone else have a follow-up question about mold toxicity here while we're at this spot? Abby, I see your hand up there.
Hi, Dr. Ross. Thank you. I couldn't figure out how to get the little hand to raise on my screen, so I just
An
raised my
active
hand.
hand works well. I'll respond to it. So yeah.
Thank you. Question. So is it okay, because I have the same situation as Cal's wife,
Yeah.
is it okay to treat Borrelia and mold toxicity at the same time?
Yeah.
Or yes, that is safe. That's good.
Yeah, but let me clarify that. Okay. So if you were to take a look at my Ross Lyme and tick-borne diseases support protocol, right, you'll see right before I even start getting into how do you deal with sleep and lowering cytokines, all those steps that I say are important. One of the big things right up top says, make sure it's not mold. Okay. So the only time I would not go after tick-borne infections directly at the same time you're going after mold toxicity is if you take a decent history. Like somebody comes to see me and I'm talking to them. I always want, even though they like, let me give you an example. I one time had a patient that was had seen a naturopathic doctor in town that that had because he couldn't think, he had severe fatigue. He was falling asleep all the time. I mean, hurting all over, bad shape. She did Lyme testing on him and all came back positive. Told him he had neuroborreliosis and that he needed to get on IV antibiotics right away or he was going to die. Those were the words she used with him. Okay. And so his mother, who's a nurse, really was kind of suspicious of this naturopath. Not that naturopaths are suspicious, don't get me wrong. It's this naturopath. Okay. All right. And so the mother, who's a nurse, came in. Her son's like in the mid 40s, mom's in mid 60s. And she goes, what do you think? And I said, well, let me talk to him. And I said, yeah, you clearly have positive Lyme test. It was a very solid test. And I said, but a positive an antibody test against Lyme doesn't mean it's still in you. It just means your immune system reacted. Because once you have antibodies against Lyme, you're probably going to still keep making them even when the germ is gone. So that doesn't prove, it just says, yeah, I need to think about it. It could be in you. Okay. All right. So I started talking to him. I said, tell me your story. And basically what it came down to is he was really healthy, had a tick bite years ago, never had any problem from it. And then he moved into a new house. And so then I said, well, tell me about that new house. How new was it? He goes, well, it was kind of an older house, actually. And I said, tell me more about that house. He goes, well, while I was living there, we discovered that these, like in the back bedroom where they had an old aquarium, we started finding black mold creeping through the walls. And I said, is it in that house that you got sick? And he said, yes. Like, how soon after you were in that house did you get sick? He goes, oh, about 2 weeks. Right. So the story said, forget the Lyme. This is mold first, right? Okay, so his story cut to the chase. I did 6 months of general binders with him, and he was 100% well. Went back, got his financial job back, started getting visitation rights with his kids again, you name it. He got his whole life back, okay? And I never did anything to go after tick-borne infections in him because either his immune system had gotten rid of them or his immune system had them under control. All right.
So
And
it depends on the history.
right. So if the history is clear, it's mold toxicity, go for that. Okay. But if you have both mold toxicity and like let's say you've seen somebody that right away did mold toxin studies and Lyme tests and they're thinking, and it's not clear from the story what came first, you can treat both at the same time simultaneously. Generally, what my approach though is to get them on your tick-borne infection antibiotics first, get stable on that, meaning stop herxing, start tolerate your medicines, then come in maybe 2 months, maybe 3 months later and start your binders at that time. Okay. Keep in mind when you bind toxins that the action of pulling them out of you causes a void in your bloodstream. The body hates voids. Our body tries to maintain homeostasis. Okay, and so if there's negative mold space in the blood, stuff that's stored in the tissues then moves in to fill it. Toxins that are stored in the tissue moves in to fill it. And that act of moving toxins into the blood, because you pulled it out of the intestines, triggers more cytokines, right? So when you start killing Lyme germs, you trigger more cytokines. That's called a Herx. When you start detoxing, you may trigger more cytokines. That's technically not a Herx because it's not from killing, but it's still the same idea. You get increased cytokines. So I try to stage it. And I usually go tick-borne infections first. Then maybe 2 or 3 months later, I will add in my binders. And you can run the two simultaneously.
Awesome. Thank you, sir.
You're welcome. Does anyone else have a follow-up question on that? Okay, let's move on here then. Hello, Bob. Let's see. When treating leaky gut, my specialty provider, I have so many to choose from, says we should start treating straight up butyrate. Do not take any probiotics until afterwards, with fear live bacteria might fall through the gut lining, causing even more chaos. Thoughts? I think your approach is to take butyric acid generating compounds. Yes. All right. So, okay, so let's just talk leaky gut and then I'll give my opinion there. So basically what happens is, and I'm going to describe the intestinal architecture first. Okay, so you have poop and then you have a layer of cells, one layer thick, and under this layer of cells is a lot of 70% of your body's white blood cells and immune cells sit right underneath this 70%. I want you to hear how significant that is. 70% of the immune system lines your intestinal tract, okay? So you got poop, you've got cells that are tight, not leaking at all, no gaps, and then you have all your immune cells down here, and you have blood vessels that absorb things that get to them, okay? Now, in healthy intestines, when your cells touch up really tight, there's no gaps between these cells. The way nutrients get from here, the poop, into your bloodstream down here is up here, because of enzymes, acid in your stomach, and digestion by bacteria, all these food components get broken into fatty acids, amino acids, and fatty acids, amino acids, carbohydrates that do not look like the corn they came from, and do not look like the green beans that they came from, and do not look like the milk that they came from. They just are the components, okay? And they get absorbed into your cells. They pass through the cells, and then they get to the blood cells. They don't trigger any immune reaction because they're just amino acids, fats, and carbohydrates, okay? Now, if you get leaky gut, which is these cells plump up and pull apart and you get gaps, now what starts happening is partially digested food that still kind of looks a little bit like corn to the immune cells down here and kind of looks a little bit like milk, hits all these immune cells down here and triggers an allergic reaction, may cause these white blood cells, some of the white blood cells down here, to release excess cytokines and you feel like crap. And some of the toxins may even get absorbed to the bloodstream too. Okay, now what your practitioner is saying, he's concerned that these gaps are big enough that bacteria can get through. I haven't seen any science supporting that, to be honest with you. Okay, and I have treated a large number of people in this situation by killing the yeast, if that's what ultimately has led to this plumping and pulling apart, or treating Lyme. Sometimes Lyme might even cause this as well too. And then putting people on a good probiotic. And my favorite these days is a probiotic that also creates butyrate. And that is a product by Pendulum, which is called Metabolic Daily. Metabolic Daily has Akkermansia in it, along with 5 different butyrate producers four different butyrate producers. And so the Akkermansia helps promote good bacteria load within the intestines. Part of the Akkermansia may implant, but also it sends out signals supporting the growth of healthy bacteria in the intestines too, okay? Secondly, that butyrate that gets made is absorbed by the intestinal cells, and it's a main heat fuel source that helps them heal and fuse back together, all right? The reason I don't use butyrate itself is butyrate actually, if you take butyrate, either pills or you do butyrate enemas, the absorption for some reason is not as good as the natural stuff that gets produced within the intestines. At least that's what some of the data shows, okay? So I prefer to just give you the bacteria that are going to make it, basically, all right? So Bob, did that answer your question? Does anyone else have any follow-up comments there? All right, let's move on then. Hello, T. Let's see. I'm not sure which test is best for chronic Lyme and co-infections, but when and how is the best time to test IGeneX for chronic Lyme and co-infections? By the way, also mold positive, meaning what time frame during treatment or go off treatment for a period of time, or sorry for covering up the camera, having an embarrassing little rat in my face. Don't worry. We'll talk to you anyhow, even though you're having allergic reaction on your face and you've got your camera.
Thank you.
Okay. All right.
Thank you.
All right. So uh, at the end here, I'm going to show you an article that describes what I think the best testing is. Okay, you may have seen that article before, but when it comes to finding the greatest chance you have of identifying whether you might have tick-borne infections in you is IGeneX, and it's doing their antibody test called an immunoblot. All right. And their immunoblot, they have an immunoblot for Babesia, Bartonella, Borrelia, Anaplasma, Mycoplasma. They've got it for all that stuff now. And they are so good at finding these antibodies that attach to proteins from the germs. This method is recognized to be what's known as 95% sensitive. By that, I mean if the infection is in you, there is a 95% chance that this test methodology will find it. Okay. I didn't say perfect. I said 95%. All right. All right.
Okay.
By comparison, you may be familiar with something called an ELISpot test, which is offered by a lab called Infectolab and also by Armin. Studies, neither of those labs have actually done their own in-house accuracy test or validation test. IGeneX has, that's where I'm getting these numbers from. Those labs have used test kits before, and an average test kit is recognized to have a sensitivity for any infection of about 85%. Okay, so I want to let you know the most sensitive test is doing the immunoblot. Okay, finally, just let me close that out. So ELISpot and immunoblots are recognized as indirect tests. We're looking for an immune reaction to the germ. We're not actually measuring the germ. Okay, am I clear about that? Okay, now a direct test would be something that can measure the DNA of the germ. We call those PCR tests, or a microscope exam where we put a marker that attaches to DNA or RNA on that. Okay, now direct test, no one has ever done studies telling us how good they are at finding an infection. And the problem with the T-Lab microscope test, which is a direct test, or the PCR methods offered by IGeneX, is that you need a germ swimming by the needle when you stick it in your arm. Most of these infections tend not to live freely in the blood. They're basically hiding out of blood because the oxygen kills them. Okay. So when you get a sample and you're doing some of these direct tests, it's hard to say how accurate they are. So most of us working with this have decided over time that probably it's the immunoblots that are more able to find infection. Okay. We do know, for instance, PCR Lyme testing, there's good studies that look at that. The PCR that's seeing the DNA of Lyme in you will only find Lyme if it's in you 30% of the time. Right? That test is only 30% sensitive, right? And so we wonder on some of these other PCRs, are they as bad too? Okay. All right. So, all right. The second part of this is how do you wind up getting the best chance of having a positive test? Can you be on antibiotics, for instance, right? So when it comes to actually doing an immunoblot or an antibody test, even the ELISpot testing, you can actually provoke a stronger test by being on antibiotics first for about 3 to 4 weeks and then doing the test. And if you are already on antibiotics, it's okay to remain on it. Okay. What we think happens when you're on antibiotics, herbal or prescription, before you do your test, is that it causes the germs to get killed. Tissues do not like to hold on to dead bug parts, and they release them into the bloodstream where the immune system has an easier time seeing those bug parts and making antibodies against it. Okay, it's kind of a simplified explanation, but so in terms of do you need to be on antibiotics? No. If you're on it, do you need to stop? No. You can go ahead and stay on those antibiotics. Okay. Now, by comparison, if you are doing a direct testing method like a PCR or a T-Labs test, you actually don't want to be on antibiotics for about a good month or so before you get that done, because you want to have an increased germ load that swims by that needle so that it might get pulled into the test tube, so you might see it. Okay. All right. So I'm not sure if I completely answered that question for you, but T, do you have any questions about that?
Well, I'm a little brain fogged right now, so I'm
Sure.
going to look forward to when the video is posted. I could listen again.
Okay. All right. Good luck.
Thank you very much.
Yeah, I'm going to just show, in case you haven't seen this article, I'm going to just show it to you here real quick. Let's see, share. Now let me go find it here. All right, so on my Lyme information site, there is an article I have, which is called The Best Lab and Tests for Borrelia, Bartonella, and Babesia. All right. And in here, I literally break down why the Immunobot is the best and how you go about ordering it. What test numbers do I recommend, for instance? Okay. All right.
Okay, great. Fantastic.
All right.
Thank you.
You're welcome. Good luck to you.
Thank you.
Does anyone have any further questions about testing while we're on it here? Okay. Sorry if you just heard a big bang there. I have a dog walker, a friend of mine, that just brought in my wild dog who's trying to get in. I'll see if last week Blue did not want to be seen. We'll see if he lets himself be seen later. Okay. All right. Blue is a rescue dog. He's a Catahoula leopard dog, which is kind of interesting. And I've had him for about 4 weeks, and he is now very attached. So, which is good. I'm enjoying his company. All right. Let's see here. All right. Hi, Sally. Let's see. Hi, Dr. Ross. Regarding tinctures such as cryptolepis, etc., are they effective with glycerin as opposed to alcohol? I don't do well with alcohol. So it's a good question. So when you do a glycerin tincture or an alcohol tincture, the glycerin and the alcohol perform an extraction of chemicals from the plant. Okay. So for instance, a standard way a tincture is made is you take raw plant, you take 1 part plant, and you take 5 parts of either alcohol or of glycerin. And you let those sit for a while, and basically the alcohol and glycerin extract out the active ingredients out of these plants, and then you remove a lot of the plant matter. Now, if you've ever taken some of these tinctures, you may notice they're a little cloudy. You can still see little particles in there. That's because it's plant matter, okay? It doesn't mean it's contaminated. It's just plant matter that didn't get all the way filtered out as they were doing their filtration. When you look at what is generally recognized as the stronger extractor, it is alcohol. Alcohol is a stronger extractor. Okay. Now, that doesn't mean you're not going to have benefit from doing a glycerin tincture, but you might need to go a little higher on your dose if you're not getting as great benefit. So, for instance, on a cryptolepis, normally I recommend pretty high dose. Many of you know that. But for Bartonella Borrelia, I would do 2.5 milliliters, which is a half teaspoon 3 times a day. On an alcohol-based tincture for Babesia, I usually recommend a teaspoon or 5 milliliters 3 times a day. With the glycerin tinctures, if you're noticing you start and you do those kind of doses and you're just not getting either a herx or much improvement over a month or two, you might want to increase by, say, 10 or 20%. Just go up on the dose. And if you notice, I'm kind of being lax about the certitude of how much. It's just you want to go a little bit more. I cannot tell you from science how much more you want to go, but I do recognize that glycerin tinctures are probably not going to be as strong as alcohol-based tinctures. Okay, all right. And then Sally, have you ever looked at? So one thing that sometimes people that are having difficulty with alcohol tinctures that I'll suggest that they do is to steam off the alcohol in that tincture. And the way you do that is you boil up some water, put 1 ounce or 2 ounces of it in a glass, and then literally take your 30 drops and you drop into the hot water. It's going to steam, and a lot, not all, but a lot of that alcohol is going to get pulled out. And then as it cools down, then you drink it basically. So that's a way for people that have sensitivities to be able to do it. Okay. Sally, do you have any follow up there? All right. Does anyone else have a question about that? All right, let's see here. Hello, Trish. Let's see. Dr. Ross. This is hi, Dr. Ross, you said actually. This is a follow-up on office hour question you answered today. I have the Bart, Babesia, and Lyme. Thank you. Recap is as follows. My protocol is Chinese skullcap, cat's claw, crypto plus, Commanda, serapeptase, Berber, Pinella. You stated Commanda has no science backing and also Berber as well. I trust you and I'm throwing this out of the plan. Can you help me with a correction plan? I read your book the other night to use Japanese knotweed, cryptolepis, and liposomal cinnamon clove and oregano combination. Is this what you recommend? Do I still add the lumber kinase and biodisrupt? Okay. So, and then Trish, do you have a second part here, which is that I never thought I had mast cell too?
Yes.
Okay, I'll come to that in a minute.
Okay, thank you.
Let's just answer this one. So, can you tell me which germs are you trying to treat?
So Babesia, Bartonella, and Lyme.
Okay, so you got the three B's. Okay, so your the cat's claw and well, actually, the Chinese skull cap, along with the cat's claw, along with crypto, and there's some black walnut in that crypto plus. That is an effective Borrelia and Bartonella treatment. It's got things in it that are going to go after growing and persister. Okay. The only thing you're really on with that combination that's going to go after Babesia is the crypto in there. All right, and none of these do anything to break up biofilm. All right, of the germ killers. Okay, all right. Now, my combination that I prefer, and this is just by working with it over time, and also this combination, every herb in there has got some data out of Johns Hopkins University lab study saying it kills. Okay. The Commanda, that's part of the Cowden protocol, has no science showing it actually kills. It's Cowden thought it works, and he says to do it, but probably we don't have the science that backs that up. Okay, all right. So the advantage of the triple product that I like is Cryptolepis, Japanese knotweed, and the liposomal cinnamon clove oregano. All right, and here's why. For Babesia, you get crypto and clove, which can kill Babesia. You get some added bonus on top of the Cryptolepis for Babesia. The three oils together also help break down biofilm to a degree. You don't get that out of the combination, the herbal combinations that you're on right now. Okay. And then what I have seen clinically is the combination of crypto, Japanese knotweed, and all of these oils are very effective in the lab against growing and persister Lyme and Bartonella. And I've seen really good clinical effect from it. All right. The other advantage of doing this over what you're on is taking less things. It's only 3 items you're taking versus all of these different tinctures. Okay. All right. I think it's probably a stronger killing combination. And you also get a better help with biofilms. In addition, though, get Bartonella, we're starting to really understand that biofilms are a major mess that kind of keeps this thing, makes it difficult to treat. Okay. Secondly, with Bartonella and Babesia, we are recognizing that both have the ability to form what are called fibrin nest, which is fibrin's your blood clotting protein. It's in the blood. These germs wrap themselves up in this and then stick on the blood vessel wall where they kind of hide wrapped in all this fibrin. Okay. I want to be clear. Fibrin nest is not a biofilm. We know that Borrelia and Bartonella also cover themselves in a mucopolysaccharide slime layer that is held together in a fibrin protein skeleton. So yeah, fibrin nest and biofilm both have fibrin in them, okay? But the biofilm has this mucopolysaccharide slime. It's got tubes in it that act as garbage disposals. It's got tubes in it that take nutrients in. It's got bacteria colonies that have nothing to do with tick-borne infections and have jobs within the biofilm. Like some of them are the post office and some of them are the grocery store. These are fully functioning communities, okay? All right. So what you do for a fibrin nest, which is lubrikinase, is not going to be enough to take care of the post office and the garbage chutes and everything else that are part of the biofilm. All right. A biofilm needs to break down the fibrin. It also needs to break apart the mucopolysaccharide slime. So you need enzymes that are going to do that. And you need some kind of antimicrobials that will start breaking down the germs in the biofilm that are not tick-borne germs, just the community that lives in there, okay? And so for that reason, and because I think that Bartonella in particular just needs as many things as you can, a lot of things to after biofilm. I like using the combination of BioDisrupt by Research Nutritionals, which is really good for biofilm, along with lubrikinase, which helps biofilm and helps with the fibrin nest. I like doing those combinations. Okay, so that's what I would suggest. Now, I'm not your doctor. I want to be clear about this, but your question was, do I think that what I'm suggesting is stronger? I think it would be stronger for you. Yeah. Okay.
Okay.
Yeah. All right. Right. Before we go on to Trish's second part of her question, does anyone have any questions about that? All right. All right. Second part. Let's see. I never thought I had mast cell, but can I ask you this? I get constant vibrations and unbalanced, not typical allergy symptoms. But I did take a few doses of Pepcid and Xyzal and it improved. I also had relief from ketoprofen, but that made me gain 8 pounds in 2 weeks. I stopped it. So to this point to mast cell, is thoracurcumin phytosome the same as doing Pepcid Xyzal combination? Okay. So in terms of vibrations, I want to be clear about that. The vibrations I often will see more in Bartonella. It's an internal vibration. It's not like you're shaking visibly, but it's more of a buzzing feeling you feel inside. I tend to associate that more with Bartonella, sometimes mold toxicity, but I tend to see it more with Bartonella. When I hear it as a symptom, I'm thinking Bartonella. Okay. All right. Now, in terms of allergy symptoms, yeah, that can be from your mast cells releasing histamines. We recognize that mast cells will release histamines just from common things you're allergic to, but also we now know that tick-borne infections and mold toxicity turn on those mast cells. So they activate the mast cells. Okay. So if you've got allergy symptoms and you felt better on things that deal with those excess histamines, like Pepcid, which is a histamine blocker, ketoprofen, which stabilizes mast cells so they don't make as many histamines and release them, but also it's antihistamine, so it blocks the histamines after. If you had improvement, then yeah, you might focus on taking something to stabilize mast cells. Okay. From an herbal standpoint, what I would use actually is quercetin, and not the curcumin phytosome. So quercetin is a very strong natural mast cell stabilizer. It's also made by Thorne. It's called Thorne quercetin phytosome, not the curcumin phytosome you said here, but it's a quercetin phytosome. It's a 250 milligram pill. I'm usually going to use it at 500 milligrams 3 times a day. It has two advantages. One, it stabilizes your mast cells. All right, so they're going to be less reactive. It's going to take about 2 weeks of using it before you might notice improvement, though. Okay, just be aware of that. The other advantage is it's an anti-cytokine. So, as you know, my protocol all says take something to lower cytokines. Well, instead of using curcumin that I usually recommend, this is a situation where the quercetin that you're using to stabilize mast cells will also help um, um, lower white blood cell production of your cytokines as well, too. Okay.
Okay.
All right.
So I did have a question. For the mast cell though, I was gonna say I don't have any like allergy symptoms at all. It's
Oh,
just, yeah, sorry if you missed that. So I just
oh,
have
not typical allergy symptoms. I see what you're saying.
so it's more like neurological
Yeah.
symptoms. And I did read that it can be mast cell too. So I'm kind of, is it cytokines or is it mast cell? I don't know.
What I would tell you, the Pepcid and the ketoprofen, if you felt better on those would have been primarily dealing with histamines. And so, in a sense, you did a medication test, if you will, and that would suggest you may have some mast cell activation to me.
Okay. All right.
All right.
Thank,
All right.
thank you.
Yep. Good luck.
Thank you.
All right. Anyone have follow-up questions to that? Okay, let's move on here then. Trish, good luck to you.
Thank you.
Hello, Bob. Let's see. With intestinal yeast overgrowth, a couple of my MDs say there is a stool test that helps diagnose this. I've seen the results from a qPCR stool test that looks impressive. What say ye? I don't care for stool tests, and let me explain why. All right, so all of us have, even healthy people have intestinal yeast. They live there. They cohabitate with us, okay? What the issue is with intestinal yeast is relative for you, do you have a relative excess of yeast? I want you to hear what I said. Relative to what's good for you, do you have too many? All right. So, for instance, I have seen people with significant yeast symptoms, sugar cravings, gassiness and bloating, um, pimples and acne that you get as a result of having intestinal yeast. I mean, like they look like they're loaded with yeast, and I get back a stool test and there's nothing in it or minuscule amount. All right. So I don't think that these tests, yeah, I mean, it may even get back a test that says you've got a lot of yeast, but maybe that's your normal. And maybe your bacteria are keeping it under control. So I don't agree because I don't find it useful. What I find more useful is, do you have symptoms of it? And the way that I do that, figure that out is if you are at the beginning of treatment and have not taken any yeast treatment before, there is a yeast questionnaire that I have. It's a 3-page tool. If you score over 140 on it, it basically is looking at risk factors for too many yeast and symptoms and intensity. If you score over 140, I have found great benefit in those situations at treating for intestinal yeast overgrowth. Okay. All right. So 140 or over, I treat for intestinal yeast overgrowth. Now, where that screening tool is not useful is if you've already treated for intestinal yeast, because some of the questions in there are historic. They look and say, have you ever had, right? Well, if you've cleared yeast, the ever hads are still going to give you a positive score, even though you've cleared yeast out. Okay. So if you've treated intestinal yeast overgrowth, then I'm going to look more at your symptoms. And so if somebody has had a big decline, think intestinal yeast. And the reason is intestinal yeast trigger more cytokines, which can make it look like your Lyme symptoms are worse and your Borrelia and Bartonella symptoms are worse, but really is worse than cytokines. All right. So start thinking yeast. Okay. And then the things to look at is if you have sugar, does it make you feel worse? If you feed your yeast, do you feel worse? All right. If you do you have increased sugar cravings? Do you have intestinal gassiness and bloating? If you're female, do you have itchy vaginal discharges? Are you having trouble swallowing? Sometimes we'll get yeast up in our food pipe and things get caught as we're swallowing. All right. But then the real interesting one is for a lot of people is skin starts looking worse. You'll start having more eczema rashes, or you might start having more pimples and acne. And there is a genetic predisposition that some people have that the toxins that get released from yeast will interact with the skin, leading to more pimples and acne. It's not that the pimples and acne are yeast on the skin. It's just a skin manifestation of having too many yeast in your intestines. Okay. So to have intestinal, let's say you're feeling worse and you answer yes to a couple of those, I'm going to say, yeah, let's go ahead and treat for intestinal yeast. Okay. Again, I find that more sensitive and accurate than relying upon a stool test. Because again, the stool test may find it, but that doesn't mean for you relatively it's too many for you. Okay. All right. Any follow up on that one, Bob? Yeah, go ahead. Unmute your microscope or your microphone there. Yeah, go ahead. Huh, we're not hearing you. Is anyone hearing him? Shake your heads if you are. No. It's interesting because I know your microphone is unmuted, but for some reason
I don't think he's talking.
he was. Bob, say hi.
Oh, no.
Sorry, I'm not able to hear you. And you're even wearing that great Texas Longhorns hat too. I really appreciate that, sitting in Austin. So yeah. I'm sorry, Bob. I don't know. Yeah. Actually, do you want to just do a quick, you want to write something in the chat box for us real quick? Oh, you scored 200 on the questionnaire. Yeah, that's high. And especially if you haven't treated intestinal yeast before, that strongly suggests intestinal yeast. Okay. All right. Good luck to you. Okay. All right. Oh, so let me just do a quick screen share here in case people are not familiar with my questionnaire real quick. All right. So back here on my Treat Lyme by Marty Ross MD, if you look on this online Lyme guide section here, click over yeast, and then come down here to this a silent problem, is it yeast? And click on that. And if you roll on down here, here is my yeast screening questionnaire right there. Okay. All right. All right. Now you may notice that my site looks a little different than yours because I actually am logged in behind the scenes here. How am I going to get, bear with me here. No. Oh, let me move that out of the way. There we go. Okay. There we go. All right. From now on, it will look like the right way. Anyhow, let me get out of that. Let me go back here. Okay. This one. And get rid of that. Okay. So somebody is registered in his iPhone 2. I don't know who that is, but we'll answer your question anyhow. Let's see, Dr. Ross, I'm a firefighter. I was in remission or what I thought was cured for 5 years, doing well. I went on a trip snowboarding and got the flu, and it seems symptoms came back, heart rhythm changes, panic feelings, insomnia, no appetite, and occasional air hunger. I was positive for Babesia dukkani and IGeneX positive for Lyme. Do you think I relapsed? I thought I was having a panic attack, but symptoms are still around. I just need hope. I'm seeing my LMD in March, just taking Crypto Plus right now. Okay. So iPhone 2, can you unmute yourself here?
Yes, can you hear me?
Yeah, and who are you?
My name is Luke. I was on the Tick Boot Camp podcast
Okay.
as the firefighter on there, and I don't know, I was sick. My daughter gave me the flu, and then I started having like heart racing, and then no appetite, and then I thought it was maybe a general anxiety thing but I've never really had psych issues before, but now all of a sudden it seems like just like 5 years ago when they all hit me, I was bitten by a tick and everything. So it's just like every day is just kind of like the worst.
Sure.
And
So let me tell you what I will tell you in my practice where I got a lot of people well, occasionally somebody would come back in fearing that they had had a relapse.
mm-hmm.
Okay. And what I found 80% of the time is that it was not a relapse. There was enough going on that had me wondering about intestinal yeast overgrowth. And I would treat the intestinal yeast and they would be back on their way. And it wasn't a relapse about 80% of the time. Okay. All right. So let me ask you a few questions.
Sure.
So let me also make a statement. When you
Can
get
you see me?
Yeah, I can see you just fine.
Okay, I'm at work. So I'm in
No,
my.
you're fine. You're fine.
Okay.
So any viruses that also hit the intestinal tract, and the flu can hit the intestinal tract, will disrupt the normal bacteria within the intestines. They'll upset the microbiome, which is a setup to have the yeast that live there take over some of that territory. Okay. What is one of the worst viruses at doing that is COVID. COVID, it's notorious that people have difficulty with intestinal yeast overgrowth after COVID because it is known to do a big disruption of the good bacteria within the intestines. Okay, but
Mhm.
flu viruses can do that too. Anything that hits any virus that hits the intestinal tract can do that.
Yeah, I was having nights of insomnia on my trip to
Yeah.
Colorado, and I would sleep for 2 hours at a time, keep waking up.
Yeah.
The anxiety didn't hit till like I got home, and all of a sudden, my heart races every time I get up.
So
Uh,
any mental health symptoms, if you have too many cytokines that are triggered by too many yeast in the intestines,
Mhm.
excess cytokines can even give you all the mental health symptoms that you're describing.
Wow.
So let me just ask a few questions. So any
Sure.
increased sugar cravings at all?
No,
Okay.
I don't have an appetite at all. Like it's just like it comes and goes. It's just like but really I just don't have any kind of will to eat.
Okay.
Um,
Are you gassy or bloated?
no, I've lost like about 16 pounds in about 3 weeks.
Okay. And then are you having any sugar cravings at all then or not?
No, no sugar cravings at all. Like no cravings whatsoever.
Any changes to your skin?
No changes, no sir.
Like are you having rashes or more pimples or acne?
No sir.
No. Okay.
Just the anxiety and panic feeling, and it just feels like when I first was like
Right.
suspected a Lyme.
Okay, so then that was the next question I was going to ask. When you initially were treated, did they treat? I think the positive testing here you're telling me that's from when you first got sick. Is that correct?
Correct. In 2020, I went to LMD
Yeah.
and he did IGeneX test and it came back positive it was IGeneX positive for Lyme, CDC negative.
Right.
And then I had a positive Babesia duncani, I guess IgG or something like that. I was very symptomatic.
Okay, so
Spectral.
he treated you for both Babesia duncani and Borrelia Lyme in the past.
Yeah,
Then?
he did the pulsing and everything, and he's a LLMD, and
Yeah.
slowly
Okay.
I started getting better.
So let me start by saying I don't think this is intestinal yeast. Sometimes people say, "Yep, I ate a whole can of cookies and then I got worse," and you think, "Well, you just
No.
fed yeast." Okay, I'm not hearing that. I'm not hearing anything that says yeast. So I agree that I would consider looking for this being Babesia and or Borrelia relapse. Let me just do
Okay.
a couple of questions here. So these are Babesia questions. So you're getting a lot of panic attacks.
I always feel kind of uneasy
Okay.
all the time. Like it just it like kind of never lets up. It comes and goes. I'm not actually like anxious, but I just don't feel right.
And are you having air hunger at all?
A little bit, but I can't tell if that's the anxiety or something else. But I do feel like air hunger and kind of dizzy.
Okay. And were those symptoms you had the last time you
Yes.
got through? Okay.
Yes.
Yeah. I can't diagnose
Right.
in a 5-minute discussion. Okay. But what I can tell you, what I'm hearing is I don't hear that this is yeast. Again, I look for that 80% of the time in these
Yeah.
situations. Is okay. You have significant symptoms of Babesia, and maybe there is some Borrelia in here. And yes, if you were treated before you got well, when you get well, there's one of two things that happen. One, the treatment eradicated every germ, or two, it lowered your germ load enough that the immune system just sat on those germs and kept them under control. Okay. And
Yeah.
now, if you get the flu, it may divert your immune system's attention so that these germs it was controlling become active. All right.
Right. Like I blew through COVID and everything. I've like been sick since I've been well, and I blew through it, and then just something happened and I just have all those symptoms come back, and they hit me real quick. It's just been about 3 or 4 weeks.
So things that you could think about taking until you see your LMD, Cryptolepis, which is in the Crypto Plus, that crypto is good mainly on the Babesia side. The Hugland's nigra and the black walnut in there might pick up Borrelia a little bit, but you might want to make that a little stronger until you can see your provider. Consider going with Japanese knotweed
Okay.
and possibly even consider adding in that cinnamon clove oregano that we've talked about here too. Okay.
Okay.
And the reason for the cinnamon clove oregano is the clove in that will help with the Babesia in addition to the crypto you're using. Okay. Um, I would say at a minimum, probably add in knotweed. If you're feeling bold before you see your provider, consider going with the liposomal cinnamon clove oregano too. Okay.
Okay. All right. Thank you.
Yeah. Good luck to you.
Thank you.
All right. Anyone have any questions there? or comments? Okay. Hello, Sandra. Let's see. I'm taking low-dose naltrexone for about a week. Now I have Lyme arthritis, which doctor says she thinks was triggered by has triggered rheumatoid arthritis. Was thinking of trying your protocol. Should I treat for Lyme and the co-infections at the same time? Toba bark, liposomal cinnamon, clove, oregano, cryptolepis, and Japanese knotweed. Should I use anything else? How long do I take the herbs? All right, let's see here. So the question, Sandra, do you know, in working with your Lyme literate doc, do you have, other than Borrelia, do you have any of the other tick-borne infections at all?
I don't know if I do at this time. I have had Babesia,
Mhm,
and that came back negative on the last test.
mhm.
I do have some.
I think you're
Yes.
answering my question. I know what bands came up as
Oh, we
positive.
got two Sandras here. This is Sandra Lalonde that I want to talk to.
Okay, I didn't think that was my question.
All
Sorry.
right. Sandra Lalonde, go ahead. I'm sorry.
I just know the bands that came up as positive.
For Borrelia.
Yes.
Do you know if you happen to have Babesia and Bartonella too or not?
All the bands were pretty much positive.
But that's just for Borrelia. You didn't have a test that said positive Babesia or a test that said positive Bartonella.
I did not.
Okay. Did they test for Bartonella and Babesia?
They did not.
Okay. So again, I'm not going to have the time to figure out which germs you have. Okay. But if you only have Borrelia in you, I think you could probably look at doing, if the goal is to treat just Borrelia, you might look at using 2 rather than 4 herbs here. And the 2 that you might look at would be the cryptolepis and the Japanese knotweed together. Or do the cryptolepis and the liposomal cinnamon, clove, oregano. The reason I'm going to try to get you to shy away from doing 4 herbal antibiotics is the more antibiotics you take, whether herbal or prescription, the greater pressure you put on the healthy intestine microbiome. All right. And we want to do as much as we can to protect the intestinal microbiome because it is responsible for directing your immune system, how your brain functions, your mental health, all kinds of things. So I would probably scale back to 2 things, and I would look at either the crypto and the cinnamon, clove, oregano as your 2 things, or the crypto and the Japanese knotweed. Okay. And then the other key components of any, to get over tick-borne infection is more than just killing the germs. You have to kind of adjust for the things the germs causes that hurt your immune system. So take a look at my Ross Lyme support protocol. In there, I have recommendations for sleep. So if you're having difficulty sleep, do some things to get sleep. Sleep 7 to 9 hours a night helps your immune system work better and lower cytokines and can help with pain. Okay. The other thing I mentioned in there is to do something to lower inflammation cytokines. I like using curcumin to do that. I would take a look at using curcumin in your treatment. I would look at the recommendations I have in there about using probiotics. And if you don't have a plant forward diet, maybe even using polyphenol and prebiotics to protect your intestinal tract. Okay. I would also look at my protocol and see if you might have intestinal yeast overgrowth using the screening questionnaire. I would take a look at those parts as well too. And I'll show you my protocol here in a minute if you're not familiar with it.
I do have the book, so I was
Okay.
trying to follow what the protocol was.
Yeah.
But
Okay.
this
You know
hard to follow.
Yeah.
Yeah.
Okay.
And how long is it, for 6 months to take the herbs?
So when you have Borrelia and you have chronic Borrelia, an average treatment length is going to be a year or more. Unfortunately. Okay. The question I often get
Okay.
asked is, can I use these herbs that whole time? The answer is yes, you can, as long as you keep seeing improvement on them. I tend not to see herbal antibiotics, I tend to see will last longer in terms of their effectiveness. In other words, they keep moving you forward. Versus prescription antibiotics, I often will make changes in those at about 6 months because I get concerned of the germs learning becoming resistant to those antibiotics. I tend not to see that happen as much with the herbal antibiotics. Okay.
Okay, I did do 2 rounds of the doxycycline and 1 round of the ceftriaxone.
Yeah. Yeah. So yeah, I mean,
Roger.
the key thing is here is Borrelia, whether you're doing prescription or whether you're doing herbal antibiotics, you're talking on average a year or more to get well.
Okay,
Okay.
thank you.
Good luck to you.
Thank you.
All right, let's see. Adriana, let's see. Interested in the treatment of complications, Lyme myocarditis, subacute form, supraventricular extracesassally, stage 1 heart failure. Lyme arthritis, particularly affecting knee joints, early osteoarthritis detected, polyneuropathy, numbness in the lower limbs, burning sensation, loss of sensitivity, and tingling. Okay. So, for the Lyme myocarditis, other than getting the infection out, I don't have a good herbal way of approaching that. This is something you need the prescription medicines that your cardiologist is probably helping you with, okay? For the Lyme arthritis, continuing to treat for your infections ultimately will help. But in the meantime, what you might want to consider adding in is low dose naltrexone. So, are you familiar with low dose naltrexone?
Actually, it's not for me, it's for my friend.
Okay.
Yeah, she couldn't join, so that's why I'm just like, I'm not familiar with that. Yeah, but
Yeah. So I would look at, I'll show you the article I have here in a minute, but
Mhm.
naltrexone is manufactured as a pharmaceutical, as a prescription. And what it's made for is to help alcoholics with their addictions and people with drug addictions. Okay.
Okay.
It basically will bind to narcotic receptors in our body. All right. But we have natural narcotic receptors. They're called endorphin receptors in our body. And if you block our endorphin receptors, it has the effect of turning on the immune system so that it is less inclined to cause arthritis. It balances the immune system so it's less arthritic, okay? And what we do it by using low dose naltrexone. So naltrexone is usually manufactured or is manufactured as a 50 milligram pill. But when we're using it to balance immune hyperreactivity by binding to these endorphin receptors, we like to use low doses of it, starting at 1.5 milligrams a day and working up to 4.5 milligrams a day. When you use that kind of a dose, it only binds the endorphin receptors for about 6 hours, and that's where the balancing of the immune system takes place. Okay. In addition, low dose naltrexone binds to pain receptors in the brain, microglia, white blood cells that transmit pain in the brain, and it stops that transmission. So you tend to have less pain as part of this as well too. All right. I'm going to show you an article in a minute you can look at for more detail. All
Thank
right.
you.
It tells you how to do this. Okay. All right. But I would look at
Thank
that because it can help it. It can get at the pain and it can rebalance the immune system so it's less tending towards causing arthritis in a sense. Okay. All right.
Okay.
All right. And then for the polyneuropathy, you want to do you want to get rid of the germs, like kill the germs that are causing it ultimately. But in the meantime, you want to heal the damaged nerve membranes, and you also want to repair the energy factories that are found in every one of our cells, but also the nerves. They're called mitochondria. When you have neuropathy, your cell power plants called mitochondria are also injured. All right. So you have injury to the nerve membrane, and then you have injury to the mitochondria. Usually that means the mitochondria membrane are injured too. Just so you know, every cell has 300 to 400 mitochondria that generates. It's like the nuclear power plant in every cell. Okay. All right. And any action you take to repair the membrane of the nerve cell will repair the membrane of the mitochondria. All right. So what I like using to repair the phospholipid membranes is a product by Research Nutritionals called ATP 360. And you do 3 pills 1 time a day of that. It's a pill that has all these fats in it. It also has a number of nutrients in it that help your mitochondria work better. Okay. In
Okay.
addition, you want to get on a strong antioxidant that will start repairing the nerves from the inside and the mitochondria from the inside, and that is glutathione. And I like using a liposomal glutathione, which means it gets really well absorbed. The product I like for that is something called Trifortify by Research Nutritionals, and that's a teaspoon twice a day. And I will show you both those products in a minute, okay?
Okay, perfect. Thank you.
Yeah. So I would look at, there isn't anything I can offer you from a heart standpoint. I can help with that LDN with the pain and helping tone down some of that immune hyperreactivity. And then we can do some things to repair the mitochondria and the nerve membrane with the ATP 360 and the liposomal glutathione. Okay. All right.
Okay, thank you.
Let me do a screen share because I'll
Mhm.
share with you some things that you can look at later too. All right.
Yeah,
So
okay.
all right, so in terms of the neuropathy and the ideas that I just discussed with you, you can look in my online Lyme guide here, look in the brain and nerve section, and click on this article called Peripheral Neuropathy. And in here, you'll see the recommendations that I make about
Okay.
glutathione and the ATP 360, for instance. Okay, so here's the ATP 360. I'm circling it right there. And these are my comments on the glutathione right here. Okay, all right.
Okay, perfect. Thank you so much, doctor.
Yeah, and then quickly, the LDN, there is a whole article on the LDN. It's right here. Okay, you can look at that. And then finally, okay, so the ATP 360, this is my store. If you were just to write ATP 360 in here,
Okay, so you're gonna find here. Okay.
basically there it is. Okay, and then the Trifortify glutathione, Research Nutritionals makes a bunch of different sizes, but this is my Trifortify page right here. Okay.
Okay, perfect. Thank you so much. Really appreciate.
Yeah. Good luck to you. Good luck to your
Thank,
friends. Yeah.
thank you.
You're welcome. Does anyone else have any comments there at all? All right. Hello, Sally. Let's see. I just had DNA test that showed my body does not detoxify mold. I guess I'm in the 25%. Yeah. So there's a genetic test called an HLA-DR test. And basically it tells whether you have the genetic profile that predisposes you to mold toxicity. Okay, now I want to be clear about something. Having the blueprint does not mean you're going to manifest the problem, right? So there's a number of steps that our body can do to correct problems after the blueprint. So many of you may have heard of something called epigenetics. So basically, epigenetics is the DNA gets interpreted. And when it gets interpreted, the interpretation can be corrected. And and also our body can manufacture substances or things that correct for this mutation of the blueprint. Okay. So just having a genetic defect does not mean that when the builders come in and look at the blueprint, that they're going to make exactly what the blueprint looks like. So instead of building you a 2-story, they may interpret it differently and build you a ranch. It's probably I hope you get my analogy, right? So the blueprint can be reinterpreted. It doesn't necessarily mean it's going to turn out that way. Okay. All right. And so the only way to know if you have a mold toxicity problem is not whether you have a genetic predisposition, it's whether you actually have the mold toxins in you. And the only way to measure mold toxins in you is to look at a urine test. Okay. Now, I know earlier today or in the last week, I think we've been answering questions about how do you test for mold toxicity. There is also a lab out now called My Myco Lab that is doing antibody testing for mold toxins. And they claim that if you have antibodies, it means you have mold toxins in you. And I disagree. And the reason I disagree is the way your body breaks down mold toxins is to make antibodies, right? So if you measure antibodies and they're there, all that says is your body is trying to get rid of mold toxins. Maybe you're one of the 75% making those mold toxin antibodies, and you're one of the 75% where your antibodies attract the immune system in to break and kill and get rid of those mold toxins. All right. So having an antibody reaction just says, yeah, you're trying to deal with mold toxins. It doesn't mean they're trapped in you. All right. So I want to be clear about that. So I don't think my mycolab is the way to diagnose mold toxins. It just says that your body's working on it. You may not have the problem. Your immune system may be working effectively enough. You may be one of the 75% that gets rid of those mold toxins. Okay. All right. And then finally, the fourth way to test for mold toxicity is to look at inflammatory biomarkers. And these are ones that are proposed by a physician named Richie Shoemaker. And Dr. Shoemaker says we should be measuring inflammatory markers called a TGF beta 1, something called a complement 4A or C4A, VIP, MSH. There's all these markers that he would look at. The problem with that is just having those markers wrong, having abnormal levels of those markers doesn't mean mold toxicity is the only thing that can cause it. We know that tick-borne illnesses can cause a lot of these biomarkers to be abnormal as well too. All right. So I don't do the Richie Shoemaker biomarker test. I don't do the Richie Shoemaker HLA-DR genetic test because it all just says you have a predisposition. It doesn't tell me you have the problem. I don't do antibody testing because all that tells me is your immune system is reacting. It doesn't tell me if they're still in you. What I do is a urine test through real-time labs to see if you actually have evidence that you are having mold toxins in you. Okay. All right. Does anyone have any questions about that? Okay. Thanks for the question there, Sally, or the comment. Hello, Colleen. You are here. Are you here still? Uh-oh. So Colleen has been asking the first question of the night most of the night. You are here. There you are. Okay, got it. Hi, Colleen. All right, let's see what we got here. I waited till 7:20. You did. That was good. I appreciate that. All right. Starting your protocol for fixing mitochondria, regaining energy by taking Trifortify and ATP 360. I understand certain things work best either with or apart from food or other supplements. So I'm trying to coordinate all the things that I'm taking. 2 questions. When in the schedule below would it be best to put the Trifortify and ATP 360? Do you see anything that needs to be moved to a different time in the schedule? All right, let's see. Schedule 1 p.m. magnesium, curcumin ferrosorb, 3 p.m. magnesium, curcumin carnitil, 5 p.m. psyllium, magnesium ginger, 6 p.m. food, D2K2 zinc, 8 p.m. magnesium citramate, curcumin, et cetera, et cetera. So you can take the Trifortify and ATP at any time. You could take it with any of these current things that you're taking when you take them at the various times. All right, and then 2, am I right to assume that taking Trifortify and ATP 360 isn't something that should be done in conjunction with Prolon? So Prolon, everyone, is a fasting mimicking diet that you eat. You take this Prolon food package for 5 days, and it's very low calorie, about 700 calories a day, and it has a mix of amino acids and carbohydrates and fats in it that give you those 700 calories, but the arrangement and the types of amino acids, fats, and carbohydrates are designed to trick your immune system, the nutrient sensors, into thinking it's fasting, okay? And you get great benefits out of fasting. One of those is you get to a process called autophagy. In autophagy, basically, the cells recycle damaged parts and clean them up and repackage them and use them again. You also get rid of a type of cell called a senescent cell that can happen if you have a lot of inflammation in your body. Some of your cells will stop dividing. They become senescent. And when they're senescent, they become huge cytokine factories. And so doing a fasting mimicking diet can get rid of those senescent cells too. All right. So that's why I advocate doing it. But you want to make sure you're taking things that aren't going to add to the calorie mix or the fat or the amino acid mix while you're doing it. So the Trifortify has fat in it. I wouldn't use that one. And the ATP 360 also has fatty acids in it. I would not use that one either while you're on a prolonged diet. Okay.
Okay. Thank you. Thank you for taking my strategically timed question.
You're
I
welcome.
one follow-up about the Prolon thing.
Yeah, and I also appreciate you letting people have an opportunity ahead of you tonight too. So thank you.
Well, it's so good that you were honest with me because then I know what to do.
I got it.
The question about the Prolon is, so I did the Prolon once. I was planning on repeating it, but I also really was eager to start the ATP protocol. And I'm not sure, should I start the ATP thing now and then like leave the second Prolon to some other time, or I'm not really sure how to time it.
So, the Prolon, I like, Prolon says to do monthly times 3 and then start doing every 3 months. I think you're still going to do well if you do a Prolon fasting mimicking diet every 3 months. So in other words, after you finish this round or you recently finished a round, I would go on your mitochondria support for a few months before you stop them and do another round of Prolon.
Okay. All right, great. Okay, thank you so much.
All right. So everyone that may be wondering what we're talking about with a fasting mimicking diet, I'm just going to show you. You can look at this later to see all the benefits of doing it. I like looking at it as a way of doing rehab, basically, even while you're still under treatment. And especially if you've built up a lot of those senescence cells, you can make a big difference in lowering inflammation by doing this too. So if you are interested in doing it, you would do fasting. So this is my article. It's called Revitalize Your Health with Fasting Mimicking Diet and Chronic Tick-borne Infections and Mold Toxicity. And in here, I even go through more benefits of it, okay? And then I talk more about how you wind up using it down here, okay? If you are interested in doing it, I have a relationship with the company where if you click on my Start Now button, you're going to go to a page and then you click another button. And basically by doing that, you get my discount, which is a pretty big discount compared to if you were to go there by themselves. And it would be hit this shop Prolon 5-day, which brings you to the Prolon page and my discount. Okay. This discount is only available in the US. They don't have the functionality at this point to make it available in Canada or to European members as well too, unfortunately. All right, let's see where we are here. Hello, Sandra. Let's see. I have small itchy spots that itch immensely. So I scratch them and they open up, sometimes bleed a little, but they feel much better when I scratch the top and open them. Do you think this is Bartonella causing the itchy spots? Do you think I have yeast, but I have other symptoms that I know of that indicate yeast? Thanks for your response. So it's hard to say. So with an itchy rash, I have to look at it, unfortunately, because it could be a number of things. And I can't venture what is the best way to have you take care of it without being able to look at it in person, not on a computer, but in person. So I'm sorry, I'm not going to be able to give you an answer on this one. Okay.
Thank you.
All right. All right, let's see. Hi, Carla. Let's see. My son diagnosed 10 years and has been fighting for the last 10 years. Lots of issues. But every time exposed to COVID or flu, his ticks get much worse. COVID triggered a new tick last August, which is still hanging around. How to help cure these ticks, so disruptive and exhausting for him? What are your thoughts about a sirolimus or Rapamune? Thank you for your help and for this forum. Hi, Carla.
Hey there.
Yeah, well, I'm sorry to hear about your son. Clearly, ticks usually means some nervous system inflammation and irritation. I mean, you know this. I'm not saying anything you don't know. And the problem is COVID can trigger that. Tick-borne infections can trigger that. Getting COVID and flu can sometimes cause your tick-borne infections to get worse. So it's hard for me to discern what the actual underlying cause is in a brief conversation like this. So just so you know, okay?
Yeah, I can only, sorry to interrupt you. I can say that he was diagnosed with Borrelia, Burgdorferi, Maya motoi,
Yeah,
Bartonella Hensley, Quintana, Babesia odoquili, Microti, Duncani, relapsing.
yeah,
It's,
yeah.
and so, yeah.
So unfortunately, I don't have a quick answer for you here.
Okay.
The best I can say is he needs to have all those infections continue to be treated.
Hmm.
And you know that. I'm not saying anything, I'm not trying to I'm not trying to give you the
No, I appreciate what you're saying.
yeah, but those underlying infections need to be treated. That often will help calm that agitated nervous system. The other thing that I have found useful in COVID actually, and in Bartonella, is to try to increase blood flow to the brain as well too. And what we know with COVID especially is, so the inside, your blood vessels have they have a layer of cell on the inside, the blood vessel endothelium. But then under that, there's another layer which is called the endothelial glycocalyx. And the endothelial glycocalyx is responsible for helping to get things absorbed into the blood vessels, but also the endothelial glycocalyx, you can kind of think of it as kind of a mucous membrane with a bunch of hair fibers that stick up, okay? And the act of blood moving over these hair fibers hits them and causes the endothelial glycocalyx to manufacture and release nitric oxide, which then gets into the vascular system and dilates everything up. All right. Right. We know from science that these ACE receptors that COVID likes to use to get into the cells, they're abundant in the endothelial glycocalyx. So one thing that happens with COVID is the endothelial glycocalyx gets damaged. Okay. All right. I also wonder, without science, because no one has done the science to look at this, but I wonder if Bartonella does so too, because Bartonella, one of the places it likes to live is in the vascular endothelium. And if it's infecting and inflaming that, it's likely causing problems to the covering surface as well too. All right. So I don't like the idea of just giving you one thing to try and it's going to fix everything, but one thing you might want to consider, okay, because with this kind of irritation, you've got to wonder about vascular blood flow in the vascular system, is take a look at a product. It's called Arterosil, ARTEROSILHP. I'll show it to you here in a minute. It's
Okay.
It's made from seaweed, Monostridum nitidum, I believe is the actual seaweed. And it basically can rehabilitate your endothelial glycocalyx. In the protocol that I use for COVID, I have people take 2 pills 3 times a day for a month and then drop it down to 1 pill 3 times a day after that. One of our members who's not here tonight has had a great improvement in her POTS symptoms and her daughter's POTS symptoms by doing this. They are reporting to me that they're finding better effect if they stay at the 2 pills 3 times a day and don't drop the dose down. Okay. So there's no science that says what the best dose is here, but that idea of, because again, if that got damaged, and COVID will damage it, you've got injury to the system that makes the nitric oxide that keeps everything dilated, right? So that's one thing I would consider looking at for you.
Thank you. I'll do some research. Thank you so much. I also have Bartonella. I was bitten by a spider in 2019.
Okay.
Wow.
It's a hard
Yeah.
one.
Yeah. And did you ever hear of vessel? Sorry.
One other thing I would think about with
Mhm.
yourself. So with ticks and nervous system agitation, there probably is, obviously we've got problems with Bartonella being part of this. You
It's
may
bad.
have injury to the mitochondria within the brain as well too, which means poor energy. Anyhow, one of the things you might want to consider with him would be looking at adding in methylene blue.
Okay.
Okay,
Yep.
so methylene blue is going to kill Bartonella. It's going to kill Lyme. It's going to kill growing and persister Lyme in Bartonella. It may have some antiviral properties, but the other advantage of it is it does a quick patch to injury to your mitochondria.
Mm-hmm.
Fact, it's being recognized as a way to help with Alzheimer's dementia, for instance, because it helps with that patch mechanism as well too. All right. Now, if he's on any antidepressant medicines, though, you'll have to be careful because it can elevate serotonin levels, and if you're on other psychiatric medicines that elevate serotonin, sometimes they're not compatible. So that's something else to look into too. You can read about both arterisol as well as the methylene blue on my site if you want to look at
Thank
those.
you. Thank you so much. Yeah, he's on a heavy Babesia treatment right now because of the Babesia urticaria, which
Yeah.
we didn't even know he had until
I got it.
2021. Yeah, thank you so much.
Let me
And
just show you where you can look at this a little bit more
okay.
too. So where I really talk about arterisol is in my COVID article. I haven't added it to my Bartonella article yet, but you can find out about it. So in the, I have it, it's called Solving the Puzzle, the Ross Long COVID Support Protocol. You'll see information about arterisol in here. Okay. All right. And then methylene blue, I have a whole article about that. Take a look at that. Okay. And I talk about the germ killing, but I talk about all the other things that methylene blue does too that are beneficial, especially for injured brain. Okay. And then one other idea you might want to look at is there is a peptide that is useful in brain trauma. And brain trauma can be whacked on the head or it can be infected brain. Okay. It can heal the structure that's injured. And that is a peptide. The product name is CerebroPep. But what it has in it is cerebrolysin, which is the actual peptide. Okay. And it's specifically what it's supposed to help with is brain trauma. And that's one pill twice a day. The company called Integrative Therapeutics makes that. So that and the, if you're looking for a source, both of those I carry at Marty Ross MD supplements, the arterisol and the CerebroPep as well too. Okay.
Thank you. Thank you.
Yeah, good luck to you. Oh, make sure you talk with his doctor to make sure it's appropriate too, because I don't know enough all about your son then too. Okay.
Yeah, no, I appreciate that. Yeah, it's a Lyme literate doctor, but the methylene blue was definitely discussed, but
Yeah.
He's so sensitive, again, neurologically sensitive. The neuropsych, the herxing is just astronomical.
It's tough. I got it. Good luck.
Thank you.
All right. All right, everyone. That's it for me for tonight. So let me see if Blue is here somewhere. Hey, Blue. Blue. Hey, Blue. Where did he go? Oh, there he is. Come here. I gotta show you. Some people want to see who you are. Yeah, come on. I built you up really big. This is Blue. He is my Catahoula leopard dog.
He's beautiful.
Isn't he pretty? Yeah, yeah. So I don't know if you can tell, but his eyes are this intense blue, which is why I named him Blue. Yeah.
Beautiful.
Anyhow, there you go. Blue, you're famous now.
Beautiful,
All right.
beautiful.
Good night, everyone.
Thank you.
Listen, I'm off next week because I'm on a retreat next week, and I will be back with you in 2 weeks. Okay. All right. Take care, everyone.
Thank you.
Bye-bye.